Hello and good morning. So it's just an educative video. Being a joint replacement surgeon, I do primary hips, which are first time hips, as well as revision hips. So there can be different reasons why you have to revise a hip replacement. One of the reasons is dislocation. And imagine every time when a patient of dislocation comes to you, if there's anyone else seeing, he will ask first question as, when was it done and who did it? So as if it's the fault of a person who has done it. So let me just tell you, dislocation is not because of fault of one person. So if you divide it, you can broadly say it can be due to patient factors, which means compliance of the patient. Because there are certain do's and don'ts for first 6 weeks, like they should not be tying the shoelace, they should not cross the legs, they should not sit on a very low chair. Having said that, there are certain medical conditions, connective tissue disorders. I still remember during my fellowship, my boss cancelled the case because patient had Ehner-Danlos syndrome, where you are at high risk of dislocation. So first is the patient factor. Next comes the surgeon factor. In surgeon factor, you can say it is the experience of surgeon, the training of surgeon, and the volume, of course. So, and like I use computer navigation, which has made my component position very accurate. As I was going to come, the third is the component positioning. So if you do not place the components in the accurate position, then the chances of dislocation do increase. Let me tell you, even after the accurate placement, there is an incidence you may have a dislocation. The other thing is the rehabilitation. So patient should know exactly what are the things he's supposed to do after the surgery. If you are trying to, squat on the floor or sit with the legs crossed initially, then of course you are at a higher risk of dislocation. So you must have a supervised physiotherapy for the first few weeks. So my take-home message is dislocation is not always due to surgeon problems. So it has got a patient factor component, surgeon factor, which includes surgeon experience and training. Then comes the implant orientation, and last but not the least is rehabilitation. Thank you.